Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre. Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke. Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiative, Lisa Valmon. Chief Medical Officer, Dr. David Johnson. National Epidemiologist, Dr. Shaluddin Ahmed. And Marketing Executive with Discover Dominica Authority, Samantha Leta. Ladies and gentlemen, good evening. Welcome to this week's COVID-19 update. Of course, COVID-19 continues to be a problem throughout the world, and we cannot neglect the impact that it has on so many sectors. And that's why this evening you will find that we have the Discover Dominica Authority with us because of the impact on the tourism sector. We'll begin this evening with Dr. Shaluddin Ahmed to present statistics on Dominica's COVID-19 situation.
Honorable Dr. Irvin McIntyre, Minister of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary of Health, Ms. Lisa Valmon, Permanent Secretary of Ministry of Tourism, Dr. David Johnson, Chief Medical Officer, Ms. Samantha Leta, Marketing Executive, Discovery Dominica Authority, and Ms. Sheena Harry, our Communication Officer. Good evening, everyone. It's my pleasure to update you today. And we have one more new case since our last press briefing. So this brings total confirmed cases to 33. The new case is a 58-years old female who returned from Guadeloupe on October 4th. And she had a valid negative PCR result prior to coming to Dominica. She was admitted to the quarantine facility on arrival as she returned from a high-risk country. She was confirmed as a positive COVID-19 on October 12 through PCR testing during our routine screening procedure on day 5 of her arrival. Currently, she is asymptomatic. There has been one contact of this case number 33, and she is also a returnee and currently at the quarantine facility, and tests will be conducted in due time. So in summary, as at today, the total number of confirmed cases are 33. Total active cases are now 4. 0 death. Only one contact of the recent case is under investigation. All other contacts were tested negative. All cases are import-related. Presently, there is no evidence of community transmission. All at this time are asymptomatic and doing well. In the last press briefing, I have explained to you all a definition of close contacts and factors that needs to be considered in order to assess the risk of contracting COVID-19. I just want to reiterate today definition of close contact again. This is based on or according to Centers for Disease Control and Prevention. Someone who was within 6 feet of an infected person for at least 15 minutes, starting from day 2 prior to the onset of illness, or for asymptomatic patients, 2 days prior to specimen collection until the time patient is isolated. So with this case definition, we know that if we are within the 6 feet distance from one of the confirmed case, and we were in close proximity for 15 minutes, then we will be considered as a contact. And there is a risk involved in terms of contracting the disease. Hence, the investigation continues. Now, I have explained some of the factors that's to be mindful. Those factors are important, not only for yourself to assess yourself as to if you are really a contact or if you have the risk of contracting the COVID-19. So this is important that you should pay attention to it. The first factor is proximity. Based on CDC, your safe zone is 6 feet away from each other. Assume that you're next to you is a positive case. So your safe zone will be 6 feet from that person. The study suggested there is a 3% chance that you may contract the disease if you are 3 feet distance away or 3 feet distance apart from each other. And the nearest person happened to be a COVID positive, then there is a 3% chance that you might contract. Hence, the reason why the safe zone is 6 feet. The other factor involves duration of exposure. That's also very important. Again, the time frame for or safe time frame would be 15 minutes. If you are in contact with someone within less than 6 feet away and in communication with the person for 15 minutes face to face, then there is a chance, there is a likelihood that the exposure risk will be high for you. So if you just say hi, hello, bye, and you're passing by a friend with a safe distance, there is a less likely or zero chance that you will contract from that individual. There are other factors involve symptomatic cases. Now, symptomatic cases weighs more than asymptomatic cases. So if you are in contact with a symptomatic COVID-19 case, there is a higher risk to contract the disease than from a asymptomatic case. Wearing a mask. This is very, very important. The study found that there is a 17% chance of transmitting the disease without wearing mask, even if you are in 6 feet apart. So wearing a mask is also important. So these all 4 factors come into play when you try to assess yourself that how risky you were at the time that you are in contact with someone. And this also provides a matrix for us to do the contact tracing as well. As I said earlier, all these factors are very important in keeping ourselves safe. The infection will occur if the amount of virus or viral load high enough in your body. So in order to keep the viral load low, you need to observe all these factors. The more you observe, then less viral load will be in your body, and depending on the viral load, patient exhibit either asymptomatic, mild symptomatic, moderate symptomatic, or severe form of virus. So inoculation of the virus depends on the amount of viral load in your body. So if you're observing wearing a mask, then it minimizes that amount. If you are in a safe distance, that even makes it farther away from the virus itself. So hence, we need to practice wearing mask all the time when you are in public and keep the 6 feet distance in order to keep the virus at bay. With it, I thank you and good evening.
And our thanks to our national epidemiologist, Dr. Shaludin Ahmed. Again, 1 new case of COVID-19 here in Dominica. But on the plus side, only 4 active cases, meaning that we have an excellent recovery rate to report. We also want to thank Dr. Ahmed for curbing the fears and anxiety of those who may feel they have come in contact with someone who has tested positive. This, of course, reminds us the importance of the public health and safety measures that we continue to stress, and why it is important to continue wearing masks and physical distancing as much as possible. No one can argue that the tourism sector hasn't been one of the most impacted by COVID-19. Here in Dominica, it's no different. We know that those wishing to come in are impacted, but those who make a livelihood from the tourism sector have also been feeling the strain of COVID-19. With us this evening, we have Marketing Executive at the Discover Dominica Authority, Samantha Lita.
Good evening to the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiative, Ms. Lisa Valmont, Chief Medical Officer, Dr. David Johnson, National Epidemiologist, Dr. Shaluddin Ahmed, Communications Officer, Ms. Sheena Harry, and of course, good evening to the listeners and viewers of this press briefing. The tourism industry, as you know, has been and continues to be affected greatly by this pandemic. We have recorded a 70% decline of stayover arrivals from January to September 2020 over the same period in 2019. It should be noted that for that same period, January to September 2019, we were already as a destination showing a 7% increase over our pre-disaster levels, which actually spelt very good news for the sector. Unfortunately, we have now been faced with a new challenge in the tourism industry, and stakeholders in the sector continue to see declines, with some actually being forced to close their doors and to, of course, lay off workers. The Ministry of Tourism, International Transport and Maritime Initiatives, along with the Discover Dominica Authority, continues to work with all our stakeholders, including the Ministry of Health, Wellness and New Health Investment, and the Dominica Hotel and Tourism Association, in aiding in the revival of the industry. We first launched the CARICOM travel bubble towards the end of August, which afforded persons from select destinations in the travel bubble relaxed entry requirements into Dominica, while ensuring safety and security of both the visitor and the residents being paramount importance to us. And on October 2nd, we presented Safe in Nature. Safe in Nature is actually a commitment given to our visitors, specifically our visitors traveling from the high-risk classification of countries in which almost all of our tourism source markets lie. Safe in Nature is a managed experience where guests are catered for throughout the first 5 to 7 days of arriving to Dominica, before they take their PCR test on day 5 to assure their health condition. It guarantees that Dominica continues to focus on the safety of our local residents and, of course, our visitors, while doing all we can to bring the essence of the nature island to them. Safe in Nature at this time is managed through the accommodation sector, who are to submit their plans to include their transportation to and from the ports of entry, activities and amenities that can be done on the property, transportation and tour services to select locations for activities that will include both land-based and water-based, land-based such as hiking the Boiling Lake, and water-based activities such as snorkeling and whale watching. Visitors to Dominica are encouraged to inquire with their preferred property of choice about the Safe in Nature commitment. The DDA is also currently working with the Dominica Hotel and Tourism Association on a booking line to ensure guests go only to safe in nature properties, as well as with taxi associations at the airport, to ensure they follow rules and regulations and play their parts. The Safe in Nature Commitment Program is already generating great interest within our source markets, and we encourage our service providers from the accommodation sector who have not already done so to prepare and submit their plans to the Discover Dominica Authority and to the Environmental Health Department. Other sectors within the tourism industry should also ensure that they're up to par with the health and safety protocols required. I should mention here that we are currently undergoing training with the Caribbean Tourism Organization for taxi operators as it relates to service and protocols in this period. We had already begun training for taxi operators and are continuing to educate and inform all our service providers. We also take this opportunity to make special mention of the social stigma that the current COVID-19 has provoked that may lead to discriminatory behaviors against our visitors, as well as anyone perceived to have been in contact with the virus. We would want, therefore, to encourage our service providers and, of course, the local community that as we continue to move forward in the reopening of the tourism industry, as we push forward with our safe in nature commitment to visitors, that we continue to make our visitors feel welcome. Stay informed with news from credible news sources and the health authorities. And of course, be informed and practice the health and safety protection of us as locals and for our visitors whilst they're on island. This may actually be the new normal for the foreseeable future, and the onus is on us to implement it properly. The tourism sector is calling on all Dominicans to ensure that we welcome our visitors, that we maintain our social distancing, and help us to partner with the Ministry of Tourism in doing our part to ensure the safety and security of all involved with the Safe in Nature managed experience. For more information, I will encourage you to visit the Discover Dominica Authority's website at discoverdominica.com and click on the Travel Advisory tab. Here you will find further details on the protocols for all risk classifications of visitors entering our shores, along with the new Safe in Nature commitment program that we bring to you. Thank you.
And thank you so much to the marketing executive with Discover Dominica Authority, Samantha Leta. And thank you to her team, and thank you to the Ministry of Tourism for your tireless efforts in reopening safely our tourism sector. Our next presenter this evening is the Chief Medical Officer, Dr. David Johnson.
Thank you very much, Ms. Harry. I wish to acknowledge the Honorable Minister of Health, Wellness, and New Health Investment, the Honorable Dr. Irvin McIntyre, our Permanent Secretary in the Ministry of Health, Wellness, and New Investment, Letitia Lestrade-White, our Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiative, Ms. Lisa Valman, Dr. Ahmed, our National Epidemiologist acting, the Marketing Executive of Discover Dominica Authority, Ms. Samantha Leta, and you, the listening and viewing audience. Good evening. Since March 2020, Dominica has been using the discharge criteria published by the World Health Organization initially in January 2020. This discharge criteria was developed based on the knowledge, available evidence, and experience in dealing with similar coronaviruses, including SARS and MERS. So the current or the discharge criteria that we have been using since then, March, indicated that for asymptomatic patients who are asymptomatic after 2 weeks of initial diagnosis are subject to further PCR testing. 2 PCR tests are done 24 hours apart. If both tests are negative, the patient is discharged. If, however, one test is negative and the other positive, then 2 weeks must elapse before retesting is done. For symptomatic patients, a period of 48 hours is allowed for patient to become asymptomatic, after which 2 PCR tests 24 hours apart are done. If both test results are negative, the patient is discharged. However, if one of the tests is negative and the other positive, retesting occurs after 2 weeks later. Once discharged, both the asymptomatic and symptomatic patients, the Director of Primary Health Care is alerted, and Primary Health Care follows up in the district for a period of 2 weeks. So today, we'll be discussing why we are talking about a new discharge criteria for Dominica. Over the last few weeks, senior technical officials within the Ministry of Health, Wellness, and New Health Investment have been reviewing a number of findings of scientific research that were done around the world. We also look at what the World Health Organization has published. And I should let you know that on May 27th, the World Health Organization has revised the discharge criteria from isolation as part of the clinical pathway of COVID-19 positive patients. This criteria applies to all COVID-19 cases regardless of isolation, location, or the severity of the disease that they have. So the criteria for discharging patients from isolation according to the WHO, published on May 27, 2020, indicated that, or advises that, for asymptomatic patient, 10 days after symptom onset, plus at least 3 additional days without symptoms, including without fever and without respiratory symptoms. The WHO is not recommending any further testing before these patients are discharged. For asymptomatic patients, the WHO recommended since May 27, 2020, 10 days positive tests, 10 days after positive test for COVID, and no further testing is recommended. However, in a more recent scientific brief published by the WHO on June 17, 2020, captioned Criteria for Releasing COVID-19 Patients from Isolation, the experts in WHO are telling us that based on evidence showing that the rarity of virus that can be cultured in respiratory samples after 9 days after symptom onset, especially in patients with mild disease, it appears safe. And I repeat, it appears safe to release patients from isolation based on clinical criteria that require a minimum time in isolation of just 13 days, rather than strictly on repeated PCR results. However, WHO emphasized that it is important to note that the clinical criteria require that patients' symptoms have been resolved for at least 3 days before releasing from isolation. Therefore, it gives a minimum time of isolation of 13 days since the onset of symptoms. We have also looked at what the Center for Disease in the USA has recently published. And the Center for Disease in the USA recommended as follows. For duration of isolation and precaution, for most persons with COVID-19 illness, isolation and precautions can be generally discontinued 10 days after symptom onset and resolution of fever for at least 24 hours without the use of fever-reducing medication and with improvement of other symptoms. It also continues to say that for persons who never develop symptoms, isolation and other precautions can be discontinued 10 days after the date of their first positive PCR test. So in reviewing our discharge criteria, we also looked, and I just want to cite two more scientific literature that we looked at. A large contact tracing study demonstrated that high-risk households and hospital contacts did not develop infection of the exposure to a case patient started 6 days or more after the case illness onset. That's a recent study. So as Dr. Hamid indicated to you, that since March 2020, we have had a total of 33 positive COVID cases were detected in Dominica. I should also let you know that only 4 of these patients had mild symptoms and just 1 had shortness of breath. So as of today, October 14, 2020, we had 29 patients who successfully recovered and 4 active cases, as you heard. 50% of our cases require a minimum of our 33 patients. An average of 50% of our cases require a minimum of 28 days to be PCR negative before we could have discharged them. We had 1 case in which it took 37 days to get 2 PCR negative results. And we had another case in which it took 42 days to get 2 negative PCR results. We recognize that prolonged periods of isolation of asymptomatic patients without symptoms, cause psychological stress and can affect the individual well-being. So, after consultation with the local consultant or public health officials within the Ministry of Health, and consultation and endorsement by both the experts at the Caribbean Public Health Agency and the Pan American Health Organization, the Ministry of Health, Wellness, and New Investment is now in a position to announce a new discharge criteria for COVID-19 positive patients who are admitted at the isolation facilities, both at St. James COVID in Portsmouth and the isolation unit of the Dominica China Friendship Hospital. And our new discharge criteria, which comes into effect today, is as follows. Asymptomatic cases require 2 consecutive negative PCR test results taken in 24 hours apart following 10 days of isolation period. I repeat, 2 consecutive negative PCR results taken 24 hours apart following 10 days of isolation period. Asymptomatic cases, and if they are not cleared by PCR testing after 10 days of isolation, The patient will continue to stay in isolation and complete a total of 3 weeks. So we have gone way and beyond, as we say in our local parlance, that what WHO and CDC is advising. After completion of full 3 weeks, the patient should be discharged or will be discharged from isolation without any further PCR testing. I repeat, without any further PCR testing. That is for asymptomatic patients. For symptomatic patients, our new discharge protocol, which comes into effect today, is as follows. For mild cases, 2 consecutive negative PCR results taken 24 hours apart following 14 days of isolation period, plus at least 3 additional days without any symptoms. If one or both of the PCR results are positive at the end of isolation or recovery period, then the isolation period will be extended to 1 more week and discharged without any further testing. For our symptomatic and severe cases, those who require ventilation or ventilator will complete 2 14-day cycle before being tested. If one or both of the PCR results are positive after the end of the 2 14-day cycle, then the patient will be discharged after a week following full recovery without a PCR test. I should let you know that the new discharge criteria that we have just announced for Dominica are consistent with international recommendations and best practices. The new discharge criteria came into effect today, October 14, as I indicated. However, the Ministry of Health will continue to be guided by the current available evidence for clinical management of COVID-19 positive patients and will seek to update the discharge criteria as more information becomes available in the scientific world. Before I leave the podium, I wish to remind everyone, each and every one of us, that we have to play a part in preventing community transmission of COVID-19 disease in Dominica. We must not drop our guards. We see what is happening in other countries. I repeat, we see what is happening in other countries. We must continue to wash our hands, often with soap and water or an alcohol-based hand rub. As far as is possible, maintain a safe distance of up to 6 feet from anyone, as far as is possible. Wear a mask at all times when you are out in the public or close contact with others. Avoid touching your eyes, nose, and mouth. Those are things that we know already, but we cannot afford to drop our guards at this stage. Cover your nose and mouth with your bent elbow or use a tissue when you cough or sneeze. Don't use it again. Throw it away safely or dispose of it safely. If you have a fever, cough, and difficulty breathing, seek medical attention immediately. One last thing. If you know someone who entered through the back door, call your nurse, doctor, or any other healthcare provider or the police. You might just help to save that person's life. He or she will be taken to the quarantine facility and get tested and be treated accordingly. In doing so, you're in fact protecting the whole community from coming down with COVID-19 disease, because the Ministry of Health will mount an aggressive contact tracing if the person is found to be positive. So, as we say in Dominica, You're not a sellout. When you report a backdoor entrance, you're helping to save that person's life and your life. And lastly, I wish to remind all of us that even if we are not in a state of lockdown, under the current health laws, it is an offense not to comply with self-quarantine. So if you're told to be self-quarantined at home and you are not compliant, it's an offense. So you can be and will be taken into quarantine facility if you are identified as a contact of a positive person and you are found roaming outside of your home. I thank you very much for your attention.
Thank you to Chief Medical Officer Dr. David Johnson. Ladies and gentlemen, you've received a lot of information, vital information this evening. Rest assured that none of the decisions that have been taken with regards to the protocols or with the Safe in Nature initiative have been taken in isolation. They are evidence-based, and they are done with the best interest of all Dominicans in mind. As always, we thank our media partners for their cooperation, for making this broadcast possible. We also thank all of you for your continued patience and for your cooperation as well as we aim to keep Dominica safe. Thank you very much. Good evening.